Hi, welcome back to Medicare Mondays. Today's session is being pre-recorded. Today's session is about Medicare, preventative care, and wellness care. What is Medicare preventative care? Medicare preventative care is a care that you receive to prevent illnesses, detect medical conditions, and to keep you healthy. If you meet the eligibility requirements and guidelines for preventative services, Part B of Original Medicare or your Medicare Advantage plan must cover that service. You can find a list of those services on Medicare.gov's page on preventative screening services. You can also call the 1-800-MEDICARE number or read your Medicare and You book for a full list. Are you seeing the right kind of provider? You may pay nothing for preventative services if you see the right type of provider. If you see other types of provider, then charges may apply to preventative services that otherwise would not have cost you anything. If you have Original Medicare, you should receive preventative services from providers who accept assignment. These providers accept Medicare-approved amounts for a service as payment in full. For provider services that Medicare covers at 100%, you owe no deductible, no coinsurance when you see these providers who accept the assignment. And if you receive services that do have a cost, these providers cannot charge you more than what Medicare-approved deductible and coinsurances are. If you are in a Medicare Advantage plan, you should not be charged for preventative care services that are free for people with Original Medicare. If you see providers who are in network for your plan. What is the Welcome to Medicare Preventative Visit? The Welcome to Medicare Preventative Visit is a one-time appointment you can choose to receive when you are new to Medicare. The aim of the visit is to promote general health and help prevent diseases. Medicare Part B covers your one-time Welcome to Medicare preventative visit, and you must receive this visit within the first 12 months of your Part B enrollment. The Welcome to Medicare preventative visit is not a head-to-toe physical. What is the Welcome to Medicare preventative visit continued? During the course of your Welcome to Medicare preventative visit, your provider should check your height, check your weight, check your blood pressure, check your body mass index, and vision. He should or she should review your medical and social history. They should review your potential for depression and other mental health conditions. They should review your ability to function safely at home and in community. They should provide you with education, counseling, and referrals related to your risk factors and other health needs. And they should give you a checklist and/or written plan with information about other preventative services that you may need. What is an annual wellness visit? An annual wellness visit is a yearly appointment with your primary care provider, otherwise known as PCP, to create or update a personal prevention plan. To keep in mind that the annual wellness visit is not a head-to-toe physical. Also, this service is similar to, but separate from the one-time Welcome to Medicare preventative visit. Medicare Part B covers the annual wellness visit. If you have had Part B for over 12 months and you have not received an annual wellness visit in the past 12 months. Additionally, you cannot receive your annual wellness visit within the same year as your Welcome to Medicare preventative visit. In subsequent, your annual wellness visit, your doctor should check your blood pressure, check health risk assessments, update your medical and family history, update your list of current medical providers and suppliers, update your written screening schedule, update your screening for cognitive issues, and update or provide health advice and referrals to health educations and or preventative counseling services. What is genetic test fraud abuse? Genetic testing, fraud, or abuse can occur when Medicare is billed for genetic screening or tests that are not medically necessary and were not ordered by the beneficiary's treating physician. We often see scammers offering cheek swab tests to obtain a beneficiary's Medicare information, which the scammer can then use for fraudulent billing or medical identity theft. Genetic testing is often advertised as one of the following: cardio or cardiac genetic testing, DNA testing, hereditary cancer testing, dementia testing, Parkinson's screening testing, and pharmacogenics, medication metabolization. Let's look for some red flags to avoid genetic testing fraud. A company might offer you free testing without your treating physician order. A company uses telemed to offer you testing over the phone and arranges for unrelated physician or teledoc to order the test. A company might bill Medicare, often thousands of dollars, for a broad range of genetic testings that you do not request or possibly even received. A company requests your Medicare number at a healthcare fair, senior center, assisted living facility, mall, farmer's market, or church-sponsored wellness event. To prevent genetic testing, fraud, and abuse, make sure to work with your trusted healthcare provider on your preventative health. Protect your personal information and Medicare number. Always read your Medicare summary notices for any suspicious charges. And finally, if you receive a cheek swab or a genetic testing that was not medically necessary, report your concerns to your local senior Medicare patrol. Rhode Island's SMP unit, you can contact us at 1-888-884-8721. Look for red flags to avoid the genetic testing fraud. To prevent these fraudulent and abuse, make sure to work with your trusted healthcare provider on your preventative health. If you need further assistance with preventative services or an annual wellness visit and have questions about what Medicare covers, you can contact any one of our partners that help service the state of Rhode Island. They are Aging Well, Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, The Point, East Bay Community Action Agency, Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, Edward King House, and of course you can always reach out to the main Rhode Island SHIP and SMP line. Thank you for attending. Please feel free to contact us if you have any questions. My name is Kim Timpson. I am the Health Insurance Coordinator for the State of Rhode Island SHIP program, along with my colleague Jennifer Riaz, who is the SHIP and SMP Volunteer Coordinator. Thank you and have a nice day.